Hello everyone, I'm Dr. Vivek Vardhan Veerapaneni, consultant allergist and pulmonologist at Shwasa Hospital, Hyderabad. In this video, I'll explain you how to use an inhaler. There are different types of inhalers, as we have discussed in another video. It's like an MDI, a dry powder inhaler, sometimes breath actuated inhalers. So all these inhalers have to be used in a particular technique to get the best results. As a pulmonologist, I see a lot of patients, and we do put a lot of patients on inhalers, and we make sure that the patient knows how to use the inhaler. The technique, it's not a tablet, it's an inhaler. So you should teach your patient how to use that inhaler. So inhaler can be used all by itself like this. Sometimes you may require a device called as a spacer to use an inhaler, and sometimes you may require a baby mask to use it properly. So depending on the age group or depending on the timing of the patient, you can choose the device. So inhaler as such, before using, you have to prime it properly. That is, if you're buying for the first time, just 2 sprays out of the inhaler. And next, just shake the inhaler properly before using and empty your lungs before taking the breath. Your lungs are like balloons full of air, so remove that air so that you can put more air in the lung. The medicine in the inhaler goes through that air. So shake it properly, take out all the air from your lungs, put it inside your mouth properly. You have to seal it properly with your lips. You have to completely seal it properly, and then, so I'll repeat the technique again. So shaking it, so what I did is I sprayed the inhaler and held my breath for 10 seconds. So you have to hold your breath for 10 seconds before taking it out, so that the medicine which goes inside the lungs goes to all the parts till the tip of the lungs and then acts there, and then you release the drug. And most of the time the drug will be already acted there, so you just exhale carbon dioxide. Then you have to put water in your mouth, then rinse properly, gargle your throat properly, and then spit it out. Once or twice sometimes, and then drink a sip of water or sometimes a gulp, and then you're safe. Almost 50% of the medicine is sent out of the system, out of the body, because most of the drug that is here will cause some side effects like dryness of mouth, sometimes some fungal infections, sometimes your voice becomes very thin or low. So all this will be prevented by cleaning the mouth and throat. So make sure you always gargle your throat and rinse your mouth after using inhaler, and then take a sip of water. So this is the technique of using an inhaler without a spacer. Whereas if you want to use inhaler with a spacer, which may look like this, a chamber that holds your medicine and prevents the escape of the medicine. Because sometimes when you use inhaler, some people use it like this, or some people like open the mouth, they don't really put it in the mouth and this is spray. Sometimes it just moves up. All kinds of techniques we have seen, sometimes in the reverse angle, sometimes like this, really. So usually this is how people take inhalers when not taught properly. But if you teach your patient properly and you reteach him whenever he comes back to you, he'll never forget the technique. Sometimes he may not be able to take it properly without a spacer, especially when he's a kid, a very small boy or girl, or sometimes when he's an elderly person without any teeth. Even a normal young person or an adult sometimes may not able to coordinate the technique properly. So you have to just put that inhaler in the spacer so it's fixed there. Then put this mouthpiece in the mouth, tightly seal it, just like I've sealed it for the inhaler, then spray. So medicine is not escaping anywhere, it's held there. So with your mouth, you take a deep breath, hold it for 10 seconds and leave it. Do it one more time. If you're not able to hold your breath, if you're too old or too young to do that, then after spraying, you have to inhale and exhale. Inhale and exhale. Do it 2 to 3 times so that medicine is completely entered into your lungs, and then put it aside. Again, the same technique follows. You have to clean your mouth and throat. So you have to clean your spacer once in every week, or sometimes once in 10 days. So make sure you put warm water with some little bit of surf, and then just shake it properly and put it aside, dry it under the fan or in the sun. Because you should not put your finger or cloth inside the inhaler, because there's static electricity in that. So all the medicine will be stuck to that part. So better you clean the inhaler properly, or else it will become white and the medicine will be stuck to the walls. So you don't want that. You want all the medicine to go inside. So always clean the inhalers every 10 days without any fail. And also put these devices, be it inhaler, be it a DPI, be it a spacer, put it in a clean area. Like you can keep them in a plastic box and then use them safely every day. Because if you put them in an open area, they can catch dust, they can catch fungal infections. So sometimes the fungus may grow inside, rarely. So all these problems are there. So keep them in a clean and safe area, and then use the inhaler just like how I've explained. Second type is using with spacer. The third one is put the chamber, put a baby mask, then put it over the mouth and you can spray. So the medicine comes through this baby mask. You can just put it like this for 10 seconds on a baby. Let the baby cry or breathe. The medicine will anyway go inside. So for 10 to 15 seconds, one puff, sometimes two puffs, especially in some elderly who cannot even do this, you have to use a baby mask sometimes in them. So this is the technique of using an inhaler. I have shown direct technique using with spacer and also with baby mask. And the next one is a dry powder inhaler where we have capsules. So you take a capsule out of this box. You take a capsule and you put it in this device. So you open the cap like this. There are many devices like this. So you can use any of the device. You put it in the device and there are pins inside the device. You press it. You close it, you press it. So holes are made onto into the capsule. So when you breathe, when you put it inside the mouth properly inside and take a deep and long breath, medicine will go to your lungs through the holes. So always make sure you make a hole with the pins. So you take a long and deep breath and hold it for 10 seconds and leave it. So it's not. That's not a technique. You have to take a long and deep breath and hold it for 10 seconds and then leave it. And you know what to do next. You have to wash and gargle your mouth and throat. So this is how you use inhalers. Whereas this inhaler, sometimes it's called as breath activated inhaler. You shake it properly, then open it. It hangs here. Medicine is inside. You put your mouth, take a deep breath. Medicine goes into the lungs. So it's like a mix of these inhaler and DPI. So it's all these are good devices which deliver a particular small dose of medicine into your lungs to keep them, healthy, because they won't let your lungs block. They won't let the sputum form. So that is what we want in our asthma and COPD patients. So in the end, I would like to tell you that inhalers are very safe and when used correctly will give you best results. As doctor, we see a lot of cases who have the inhaler with them, but they don't know how to use it, or they use it wrongly, or they sometimes use it even after the inhaler is empty. The canister, even after it is empty with the medicine, it must still sound like or feel like there's a medicine inside. So use an inhaler with dose counter that will show you the number of doses that are left. If it is in the red color or if it is going to less than 20 or less than 10, then it's time to discard your inhaler. But be responsible, do not discard it wherever you want to. You always recycle it, put them in plastic bins and just recycle them properly, because they are also hazardous, and keep them away from fire because these are canisters with medicine inside them. So myths are something that are very strong around inhalers. As a doctor, as a pulmonologist, I would like to tell you that all the myths you have heard about inhalers are false, and there are a lot of truths that I've demonstrated in this video about inhalers and how to use the inhalers. So I hope you have understood how to use the inhaler. Don't forget to share this video to your friends or people who are suffering with asthma and COPD, because sometimes they may be having everything with them and they don't know how to use it. So that is the last thing we want. We want a patient to know properly. They should know how to use it properly, and this can prevent a lot of complications. Finally, I would like to say that a right inhaler prescribed by a right doctor with the right dose for the right patient, the right time, will give the right results, the best results. So choose your inhaler as well as doctor wisely. Thank you.
We'll be covering all topics which commonly affect patients on a day-to-day basis.
For more this type of doctor advices or opinion or any other things,
దయచేసి డాక్టర్స్ అడ్వైస్ ఛానల్
లైక్ చేయండి, కామెంట్ చేయండి, షేర్ చేయండి.
సబ్స్క్రైబ్
to this channel, Doctor's Advice.
10 మందికి ఉపయోగపడేలాగా చూడండి. థ్యాంక్ యూ సో మచ్.